This is Robert Casanova. Thank you so much for watching this video. It was originally presented as a PowerPoint by Laura Livingston from Texas A&M University. And I want you to go through it and pause whenever you want so that you can read the small print. I'm only going to go over it as an overview. The main reason for this video is for us to go over the new communication checklist that we will be using at Texas Tech University Health Sciences Center for all future OSCEs. The list was taken from the CS website. CS is a clinical skills exam that the students take. It's the second major milestone that they have to pass in order to get their medical licensing. It's very important and involves having a series of standardized patient encounters. And that is why we have our practice OSCEs on all of the campus, as well as the all-campus OSCE, also known as the longitudinal clinical skills exam. This shows you the standardized patient checklist. Ours won't look exactly like this, but you see that there are 10 components. I'm going to go over each one of the 10 components and give you an idea of what it is that we're looking for. In the past, we had general questions, and it was sort of your gut feeling as to whether they accomplished what the question asked or whether they did not. We want to be much more specific, and especially we want you to provide comments so that the students know what they're doing well and what they're not doing so well. The first question is that the student establish rapport by listening attentively. That involves eye contact and body posture. It also involves nodding and verbal acknowledgement that they understand what is going on. You also don't want them to ask the same question twice, and you do want them to pause between questions and after your answer and not to speak over you. The scoring is on the bottom. The second one is that the student shows genuine interest by showing concern and being respectful. This is where the student would make empathic statements regarding your situation, acknowledging that they understand what you're going through. The next one, the student asked or commented on your health and how it's affecting your life. This means that the student says, oh, it sounds like this symptom is really messing up with your routine, or it must be difficult to make it through the day with all of this going on. Number 4, the student explains clearly without medical jargon what is happening to you. So this is where the student tells you what is going on right now, what your diagnosis is. Number 5, the student explains again without medical jargon what the next steps would be. So this is where they're telling you what your next diagnostic step would be. They might say, so we're going to order some lab tests, draw some blood. We might get an ultrasound and maybe a CT scan. And number 6, they provide information and contact that's appropriate for you. And this bit depends on your patient role in the situation. So if your standardized patient is a nurse or a physician, they might get a little bit different information than if they are a postal worker, a housewife, or a school teacher. And number 7, they ask specific questions to confirm your understanding. This is really difficult for the student because a lot of times they want to say, can you tell me what I just told you that you just had? But that's a little bit difficult. I usually ask them to tell me, so you're going to be going home. How are you going to explain to your family what I just told you? Here's further instructions. Again, you can pause this video to see the specifics. And number 8, they want to assess your ability or willingness to carry out the next steps. So they want to ask you, does that sound like a reasonable plan? Do you think you can go get your blood work next week along with a chest x-ray? Do you think you can really go and buy these pills and start them by this evening? So they want to make sure that you understand. You do have the right to refuse health care, and so the student is confirming that you're willing to take the next step. And number 9, they demonstrate understanding of the reason for your visit and any concerns that you might have. This is pretty obvious. You can read those instructions. And number 10, it's a statement of understanding and support to acknowledge your emotions. So in this, they want to show empathy. For example, if they're taking a family history and you say that your father died a couple of months ago, they might want to ask you how you handled the situation. This gives you an idea of the flow chart or the order and flow of these things. So the global items include just basic attentiveness and establishing rapport and genuine interest. While they're taking your history, they might want to comment on how your life is affecting you. While they're doing your diagnosis, they want to explain what's happening to you right now. They want to explain the next step, and they want to provide information and content that is appropriate for you. At the end of the encounter, they're going to want to confirm your understanding and assess your ability to carry out the next step. And the other global things are the showing that they understand your reason and also some sort of understanding and support to acknowledge your emotions. One of the things that may want to do is that if you're in a lot of pain, they may say, I see that you're in a lot of pain. I'll get you some pain medicine as soon as we get through this physical exam, or I'll write you a prescription for going home. Thank you so much for your attention. I really appreciate the time that you've taken for this. This is a very important test for the students, and one of the most important functions that you can serve as a standardized patient is to give the student written feedback and comments that are very, very specific to how they interacted with you. You will be provided with a printout of this presentation that has a lot more detail. I would keep it handy even in the exam room so that you can refer to it as you grade the students. Again, thank you for your attention.